So, how do we think about work restrictions? How do you determine if someone is a work restriction is appropriate? And the best way to do that is to consider three things: risk, capacity, and tolerance. And risk refers to the chance of harm, again, to the person, to the general public, and if the patient engages in a specific work activity. When a injured worker should not attempt a certain activity because of a known risk. This is a appropriate time for physician-imposed restrictions. If he's done a rotator cuff surgery, he knows it was terrible, and this person should not be lifting cinder blocks over the head. That's the perfect time for a physician-imposed work restriction. A work restriction is something that the person can do, but they should not do, opposed to a work limitation. So maybe this person has had a terrible rotator cuff injury. They could put a cinder block up there. After going to physical therapy, they're physically able. But if they do this repetitively, they're going to end up tearing it again. So because of known risk and the task being inherently risky for that injury, a work restriction is appropriate. A work limitation is something that the patient cannot do. So you can look at it as an impairment. The person is impaired. They can't lift their arm over their head. If they can't lift their arm over their head, then putting a cinder block over their head is impossible. So because they can't even lift their arm overhead, this is a work limitation because they're unable to do it. A work restriction, they could do it, but they should not do it because of the inherent risk. So that's the difference in a work restriction and a work limitation. The light bulb came on to me when reading the definition of a functional capacity evaluation. And a functional capacity evaluation is using functional testing to assist in establishing whether there are functional implications to the injured worker's clinical condition. To accomplish this goal, the evaluator attempts to identify what the test attempts to identify what the worker cannot do, should not do, or what he or she will not do. So if you look at what they cannot do, that is a work restriction. If they can't lift their arm over their head, they can't do above shoulder level work. What they should not do, if because of their medical history, this task is inherently dangerous, that's a work restriction. Or what they will not do, then that may fall into psychophysical area or lack of effort or catastrophizing or fear or whatever you may call it. And that FCE does not look at intent. All FCE does is document what the individual does on the day of testing. Everything is hinged upon that patient fully participating in the evaluation and giving their best effort during testing for the information to be useful for defining work restrictions, work limitations, return to work. So FCE, again, looks at three areas: biomechanical, strength, range of motion, endurance, cardiovascular, and psychophysical, because any one of these three areas can hinder return to work. So risk. Does the activity present as substantial harm? So substantial harm is objectively verifiable worsening in the patient's condition, not merely an increase in present symptoms like pain or fatigue. So if someone gets fatigued doing something, then a work restriction may not be appropriate. Like 90% of the people that are doing sustained work overhead, their shoulders start burning and they get fatigued. That doesn't justify a work restriction. A work restriction is appropriate if it is inherently presents as a substantial harm based upon their medical history and their clinical presentation. Capacity, which is where a functional capacity gets its name, refers to concepts of strength, flexibility, endurance. Capacity is very scientifically measured, and it's the basis of a functional capacity evaluation. What occupational health nurses, physicians, vocational rehab, what they're all interested in is a person's current ability. What can they do at the time? Capacity is fluid in that you can get deconditioned from being off work. Your condition can be improved through returning to work or through programs like work conditioning. So capacity or current ability can increase. Where people normally get mixed up is on the concept of tolerance. And tolerance is a psychological concept. It's the ability to tolerate sustained work or an activity for a given level. That's your tolerance. Tolerance is not scientifically measurable, and it is variable. Most of the time, a worker's tolerance is way less than their capacity. And I've conducted over 1,500 functional capacity evaluations. With every functional capacity evaluation, we try to get an idea of the person's perception of abilities, and we'll ask them, what can you lift from your waist and put it in that cabinet right there? What can you lift from the floor and put it on this table? They'll say 5 pounds. When we do their functional testing, they may lift 50 pounds. And some of this may be that, hey, they have not attempted it, they may be scared. I really don't know all the reasons, but 90% of the time, the person's description of tolerance is way less than their functional ability. And tolerance is dependent upon rewards. A person that is self-employed may tolerate greater symptoms and return to work a lot quicker than someone that's not self-employed. And tolerance is exemplified when a worker may be won't go back to a job because he says he can't tolerate it, but he gets a better paying job, he'll go and endure the symptoms for the increase in wages. So tolerance is a very difficult area. And if you rely on what the person is telling you, you can't make decisions based upon what the person is telling you. That's why functional testing, if someone is applying for disability, the law does not let you go on the person's description. They require functional testing. And functional testing is the only way to objectively define the individual's safe work capacity. If you have two physicians and the patient is telling one physician one thing and telling another physician this thing, and you're trying to see what this person can do, the physicians may not agree on questions of tolerance. The best way to make a question is to stick to risk of harm. Is the activity an inherent or presents as a substantial risk of harm in the person worsening their medical condition? If someone has a knee problem and they're primarily sitting and their knee aches a little bit, they have some discomfort, and they can move their knee, that's not going to make their knee worse. It's not going to make their arthritis worse. I worked with a lady that had Harrington rods in her back for years, and she was in tremendous pain, and her face would be drawn, and then when you talked to her, she would brighten up. But her job did not cause any further deterioration in her level of functioning or any progression of her symptoms or her pain. So she would have been at pain at home or here, but this job that she had did not cause any deterioration in her level of functioning, and she could do it fine. So when there is no objective pathology, but rather only symptoms, and the symptoms are out of proportion to the physical examination, most physicians agree that working despite symptoms provides no risk. If someone has low back pain, they've had MRIs, they had EMGs, they're negative, there's no objective findings, there's nothing that they can find to substantiate the claims, then the question is, what condition can be made worse from doing the activity? So how can you do a work restriction that's based upon substantial harm when there's no condition that anyone can find that can make the condition worse? So a FCE looks at these things. FCE is a short, intensive evaluation that focuses on the major physical tolerance abilities, musculoskeletal strength, endurance, speed, flexibility. And again, it attempts to identify what the worker cannot do, should not do, versus what the worker will not do. Now, impairments. Impairments are based upon the 6th edition of the guides, and the guides define an impairment as a significant deviation or loss in the use of a body structure or body function in an individual with a health condition, a disorder, or a disease. A disability, on the other hand, is an alteration in the individual's capacity to meet personal, social, or occupational demands because of the impairment. So the impairment is what is wrong with the health of the individual, and the disability is the gap between what the individual can do and what the individual needs to do or wants to do.